Hi, I'm Dr. Janet McCabe. I'm a registered nurse. I have a PhD in nursing, a master's in education, and I've been involved in the undergraduate education of nurses and research since about 2009. And today I'm excited to talk to you about the social determinants of health in the context of intellectual disability. So throughout the presentation today, I'm going to explore how the social determinants of health impact individuals with intellectual disability and talk to you about why we care about this and why we care about our understanding of the social determinants of health and how we can improve the care that we provide in the lives of those that we work with, specifically individuals with intellectual disability, their families, and the communities that they live within. So I think it's important that we go over some key definitions before I get into the presentation. So we've already talked a lot about the social determinants of health, but I think it bears a reminder as to what we're talking about. So the World Health Organization defines the social determinants of health as conditions in which people are born, grow, work, live, and age, along with a wider set of forces and systems that shape our daily life. So think of things like economic policy, development agendas, social norms, social policies, political systems. These are all non-medical factors that influence our health. So things like income and social protection, education, working conditions and job security, working life conditions, food insecurity, our housing, basic amenities and the environment, early childhood education, and access to affordable health services. Developmental and intellectual disabilities are another definition that I think we need to discuss. Developmental disabilities is a really broad umbrella type term that includes intellectual disabilities. An intellectual disability is a condition that's characterized by significant limitations in both intellectual functioning and adaptive behaviors. And typically these originate before the age of 21. Sometimes we see the number 22 thrown around as well. So what is intellectual functioning? It's a really good question. What we talk about when we mean intellectual functioning is mental capacity. So things like learning and reasoning and problem solving. And adaptive behavior are the skills that we learn and that we do and enact on a daily basis. So conceptual behaviors like working with money, the concept of time, the concept of self-direction. Social skills is another adaptive behavior. Can we problem solve in social situations? Do we have an awareness of following rules and laws? And do we have interpersonal skills and awareness? If I'm standing too close to someone, do I recognize that that might make the other person uncomfortable? Or can I understand how a person's feeling just from looking at their social cues? And lastly, a different adaptive behavior is practical skills. So think activities for daily living. Doing your own personal care, showering, bathing, that sort of thing, brushing your teeth. Cooking, can I cook for myself? Do I need help cooking? Occupational skills, can I have a job? What kind of a job can I do? Do I have access to healthcare and can I access healthcare? Can I travel? Can I use a schedule? Do I know how to take the bus to a shopping center and home again? Would I be able to do that independently? Do I understand routines and am I able to follow a routine? Can I use money? And can I use the telephone? Things like that. So some examples of an intellectual disability would be Down syndrome, Fragile X syndrome, and autism. All right, so now that we have some basic terminologies down, let's talk about social determinants of health in the context of intellectual disability and health. Let's start off broadly. Just think health. So economics. Do I have access to financial resources, employment, and income? Well, we know that in individuals with intellectual disability, this population tends to see lower employment rates and definitely lower income levels compared to the general population. They also may experience poverty as a barrier to accessing care and the resources that they need to access care. So when we think about income and job security, this can all get lumped into the fact that people with ID may not have money to actually access services that they need. They may not be able to have a job which provides enough income to eat healthy. So that's an example. Education is another great example. So think education, access to quality education, lifelong learning. We could even talk about early childhood education. Well, we know that individuals with intellectual disability may have limited access to inclusive education and specialized supports, especially depending on where they live in the world. In Canada, in Ontario, people with intellectual disabilities would have what we call an individualized education plan if they were in a school system. So that would be a plan that would help them learn to the best of their abilities and identify needed supports. However, that same system may not exist in other places in the world. We also know that education has an impact on the health literacy and one's ability to actually manage their own health, so have some sort of autonomy. Consider if you couldn't read. Would you be able to understand the instructions that the pharmacist is giving you on how to take medication if all they give you is a written piece of paper? Maybe not. So we have to think about, in the context of intellectual disability, our health education as well. What about social and community supports and contexts, relationships, experiences of discrimination? We know that individuals with intellectual disability have a higher chance of being socially isolated and may lack community integration. It wasn't that long ago in Canada that we saw the closure of large institutional facilities for people with intellectual disability and a reintegration of this population into day-to-day society. So now we see more people with intellectual disabilities living in smaller group homes with family, in group settings independently, rather than a large institutional congregate living facility. However, we also know that people with intellectual disability continue to face discrimination, some stigma, and marginalization. In the context of health and healthcare, so access to healthcare services, we can talk about health literacy again, and we see that people with intellectual and developmental disabilities have disparities when we look at access to equitable care, to timely care, and to specialized health care. Not everyone that they interact with in the healthcare system is going to understand how to work with an individual with an intellectual disability. They may encounter a nurse or a physician or an occupational therapist who's talking to their caregiver versus directly to the patient. And that could be not only infuriating, but also that person may be missing out on important information that the client actually has to share. There's actually also a lack of understanding of intellectual disability among healthcare providers, which can lead to further suboptimal care. In the context of neighborhoods and the built environment, so safe housing, transportation, and access to healthy foods, we see that people with intellectual disabilities may have limited access to appropriate housing and transportation, and that continued environmental barriers might impact things like physical activity and participation in society in general. We can also think about how elements such as policy and governance and social-cultural factors influence the health of an individual. If a government doesn't have a policy about providing individuals with intellectual disabilities a monetary benefit, they may not be able to have anything close to a living income. So in Canada, we have disability programs that actually provide a supplement to income. It is not big and is not nearly enough, but it's a start. So that's just an example. Another example would be around social cultural factors and how people with disabilities are seen within a specific cultural group, and which may then place a value on their worth as an individual or how they are to be treated. And that could be an added layer that may lead to additional discrimination or not. So now that we know a little bit, just the surface of what in social determinants of healthcare look like in the context of intellectual disability, how can we address some of these within nursing? Well, one of our key roles is definitely around advocacy and policy change. So it's really important for us as registered nurses to advocate for large systemic system change that addresses things like inequities in income, inequities in education, and looking at housing and how people with intellectual disabilities find access to housing, their living conditions, etc. We also really have to leverage all of the collaboration that we have with our other disciplines, so interdisciplinary collaboration. As nurses, we need to work with educators, with social workers, and have a strong understanding of the community organizations that are available to support and address all of an individual's needs. We also need to build our support networks both with each other and leveraging our community resources and really understanding all the different roles that people have and can have, ensuring that we're maximizing everyone's scope of practice so that we're providing individuals with a robust healthcare experience. Lastly, another strategy that we could look at is improving the health literacy and accessibility to health education. So again, going back to my example of the pharmacist, we really need to tailor the material that we provide for health education to be really inclusive and accessible for individuals with intellectual disability. We have to consider that they may have high literacy levels or low literacy levels and ensure that something for everyone is included, and also understanding the literacy level of your patients. We also really need to focus on our healthcare education and training healthcare providers to deliver competent patient-centered care and to be able to take the time to ask the important questions like, who do you live with? Are you going to be able to manage this medication on your own, or do you need help at home to help you manage? Who's going to be at home to take care of you after surgery? Those types of questions are really important to ask and understand and listen. These are not conversations that can be rushed. So in summary, I'm going to wrap up a few key points. We know that the social determinants of health play a huge and significant role in the well-being of individuals with intellectual disability. It is not just about their current health status, it's about maintaining health and health promotion. People with intellectual disabilities use emergency rooms at a disproportionate rate to people without intellectual disabilities. So we're obviously not doing a good enough job of providing basic care and health promotion and health prevention to our population. We also have to address all the social determinants of health, working through things like advocacy, collaboration, and higher level policy changes. So a few things that I really want you to take away from this presentation are that you should be extremely proactive in advocating for social justice and equity in care. I'm using intellectual disability as an example, but these could apply to a number of different priority groups. The other thing is to emphasize the importance of education and awareness in improving the health outcomes for individuals with intellectual and developmental disabilities. And that means taking some time to reflect on what you don't know and how you might alter questions if someone did have an intellectual disability. And that might really help you in the long run and hopefully will help us improve the living conditions and the health of individuals with intellectual disability. Thank you so much for your time, and I look forward to discussing all of this with you online.